So, good afternoon, everybody. Gary Shapiro, Southwest Financial Center. Today, I wanted to cover real quickly, in there a couple few minutes, and answer the question: what is Obamacare? Obamacare, of course, is in the news lately, but I thought, it should be, more specified as to what that overall term means. So, for most people, Obamacare means the type of policies that you can get nowadays. So, keep in mind that this law, the Affordable Care Act, was passed by President Obama, springing forth from that law that offered all the essential health benefits, major medical plans, where people couldn't be discounted against buying a policy, or a huge increase in the rates or premiums paid if they had pre-existing conditions, or for those that were older, or women were charged more than men uh, to a huge degree. Um, Kids now, because of the Affordable Care Act, can stay on their parents' plans until they're age 26. So an awful lot of good came from those patient protections. Uh, and with regards to the plans that were designed by the insurance companies to comply, they're for those that are under age 65. You can buy them on the marketplace, which means you're going to get tax credits from the government to help pay for those monthly premiums. And if you have higher income, you're not going to be able to buy them on the marketplace to get tax credits. You buy them direct from the insurance company or through a broker. Those that are at or below the poverty level, the federal poverty level, FPL, those people get their health insurance from the Medicaid expansion that was enabled by most governors. Certain Republican governors in certain states did not opt for the Medicaid expansion. Here in Arizona, we're lucky enough, even with Republican governor and legislature back then, they opted for the expansion. So that's essentially, two parts comprised of: one in the law, the Affordable Care Act, and with all the protections that went into it. Also, it impacted Medicare for those that are age 65 and older. It addressed the prescription donut hole, the gap that people, after spending $2,900 in prescription copays, up to about $4,400, $4,600, they had to pay this huge amount, or 50% or 65% of the retail cost instead of their regular copay, whether generic or not. And it offered then, it enhanced their Medicare by mandating that enrollees would get free preventative services as well. 26 some free screenings, health screenings every year, or 2 or 5, in order to address problems early on as an early detection warning system. So how it fits in overall with other types of plans, we'll get into that in a part 2. But I just want to quickly address what is Obamacare, since that's all over the news lately. It's really good to see that people are interested in making sure that they have insurance that's available to them, and that's covering conditions where, prior to the ACA, a lot of people that came into, for instance, our office, or were looking to buy insurance, couldn't get it because of pre-existing conditions at all, or had to get to a $10,000 or $25,000 annual deductible to even be able to, consider being able to afford it if they weren't otherwise covered by an employer. So didn't want to go too many levels deep. Just want to address that. The next video will get into where it fits the Affordable Care Act / the health insurance marketplace, where those type of plans fit with all the other types of insurance and or health plans that are out there. So for now, have a great day, and we'll see you hopefully on YouTube, on our YouTube channel. Take care.